Well, many people who are obese or overweight need some outside help, especially when excess weight starts to affect their health. Medically supervised weight loss is an option for some, and specialized diet is just part of the program. Dr. Barrow with the Lake Area Medical Center is here to answer some of your questions that you might be having when it comes to getting rid of those extra pounds. And it seems like it's something we all fight at some point during our lives, but at what point are you considered medically obese and maybe you need some help really taking care of things?
What's considered obese is a BMI of 30, which is body mass index. To find your body mass index, you can just get on your smartphone and type in BMI, and they have lots of calculators that'll come up.
Okay, and it seems to be an increasing problem across the country with both children and adults.
It is. Childhood obesity has actually leveled off, but adult obesity is still a growing problem. So.
And is it we're just eating too much, we're not exercising? Is it those basic things, or are there genetic components as well? Or are some people just naturally heavier?
All of the above.
Okay. So we have all those things we have to contend with.
Yes, it's multifactorial, so there's a lot of different ways to approach it.
All right. It's not just a question of how you look in your clothes. It's a question of it affecting your health as well. What kind of problems do you see with folks that are dealing with obesity?
So everybody knows about the common problems like diabetes, high blood pressure, heart disease, but many people don't know it leads to sleep apnea. It leads to certain types of cancers like breast cancer, and other female cancers as well.
Okay, so when we talk about medically managed weight loss, what are we talking about? What can you do for folks?
So it's like we talked about earlier, there's many different reasons why people are obese. So we sit down and talk to the patient and make an individualized plan for them. Usually the medical component is a diet medication.
Okay, and how do those medications work, and do you have to stay on them for the rest of your life?
So the first thing to be on a diet medication, you have to be supervised by a physician. You have to have a BMI over 30 and have tried dieting before.
Okay.
Most diet medications work by decreasing the signal to the brain for hunger.
So you're not feeling that starving feeling
Exactly.
all day long.
When we diet, and everybody knows when you first start dieting, that first week or two you're extremely hungry, and this will help kind of knock that out.
Okay.
Gives you a little boost to kind of get over the hump a little bit.
Is that the only thing that we need to do is take a pill? Is that a magic answer?
No, and so that's the big misconception with patients is you just take the pill and you're fine. But the pill doesn't actually speed up your metabolism or do anything. You have to watch what you eat. And what we do in the program that I do is I make the patients keep a food diary. There's many different ways you can do that. There's a lot of popular apps on your cell phone. Weight Watchers is a great way to do that as well. But you have to do something where you're counting your calories.
Okay, and I think a lot of people when they first start doing a food diary are surprised at how often and how much they're eating.
Yeah, and the reason I like the food diary is it's behavioral training. So if you know your budget of calories is so many calories, you're not going to go spend 1,000 calories at breakfast and only have 400 or 500 calories left over for the rest of the day.
Yeah, it really makes a change in the way you're thinking about what you're eating. Well, you do have a seminar that's coming up. This is going to be next Tuesday from 6 to 7 at the Lake Area Medical Center. Do people need to call to reserve a seat? I'm assuming it's a limited number of people that you
it's limited. It's in a small classroom. They can ask questions. It's very intimate setting, so there are limited seats. So they'll just call and make an appointment. We'll get them in.
All right, and this is your chance to ask the doctor all those questions about weight loss options for you, and maybe this is going to be the year you can drop those pounds and feel healthier. Thanks for coming in today.
Thanks for having me.
Good to see you. Well, stay with us. We're going to be right back after the break.